I'm Dr. Neilson with Nuvia Dental Implant Center. Today I'm going to talk to you about how long it takes to get implants after getting extractions. So generally after extractions to get dental implants, if you're just getting a single tooth or an implant bridge, most of the time you need to have the teeth taken out, graft, so put bone graft in the sockets where the teeth were, and then you let that heal for about, it's a little different for everyone depending on how big the graft is and then the age and health of the patient. It's anywhere between 3 and 6 months for that to heal. And then you come back and place the implant in the bone. You don't put a crown on it yet, but you place the implant in the bone, and then you wait another, usually around 3 to 4 months before putting the crown on. So in some cases it could be, 6 to 9 months, maybe even a little bit more before you get a crown on top of an implant that's placed. The other option for dental implants is when you could do an immediate implant placement. And so that clears up some time because you don't have to wait for the bone graft to heal generally. So in this scenario, you'd have a tooth extracted, have an implant placed in the bone. You would not have a crown put on it yet. And then you'd have to wait usually around 3 to possibly 6 months before you put a crown on top of it. So that would save you some time, but that's not really the case for everybody. It really depends on the bone availability and the quality of bone. What we do here at Nuvia, we are able to kind of skip a lot of time, and the reason for that is because we splint together all the implants with a really strong prosthetic. Your permanent prosthetic you get 24 hours after surgery. It is so strong, it splints the implants together, so it makes them all stronger as a whole than any one of them are individually. And so instead of getting a tooth extracted, getting an implant placed, and having to wait a long period of time for everything to heal, with splitting the implants together with the prosthetic teeth, that allows us to give you strength immediately and be able to go home with teeth literally 24 hours after your procedure. And so that's what we do here at Nuvia. When patients don't have enough bone or they need a different kind of procedure done because the location of bone isn't where we want it for our procedure, for the full fix, what we do here at Nuvia, then there are other ways around that. Sometimes we can place zygomatic implants or pterygoid implants. These generally do not change the time frame on which you get your teeth or your healing. It may change your sensations afterward a little bit, like where bruising is, where a little bit of swelling is, but it generally doesn't. It usually keeps things about the same. There is a very rare scenario where we would need to, where there's so much, it's generally because of so much infection, but if there was so much infection and then we just didn't have the bone available, there is a rare instance where we would take out teeth first, graft everything, let everything heal, and want to wait about 4 to 6 months before we place implants and then put the prosthetic on top of that. But even doing it that way, we're able to give you teeth faster than the standard way of doing it because the teeth are splinted, or the implants are splinted together by the prosthetic teeth. If you want to see more videos, you can click here. If you want to see if you're a candidate for dental implants and being a patient here at Nuvia, you can take a 60-second quiz, click here.